What's up, guys? Felix here, your friend in the neighborhood EMT. And today I want to talk about seizures. A lot of different kind of seizures. You have partial seizures, you have tonic-clonic, you have psychosomatic seizures. But today specifically I want to talk about two of them. One of them being a petit mal seizure. And this is like an absent seizure. This is like when someone's having a conversation with you, all of a sudden and they come right back and continue speaking as if nothing happened, all right? This is just when someone just blanks out for a little minute, right? Usually this happens in children, and usually it stops when they get into their teenage years. Sometimes it doesn't. Sometimes it progresses into a grand mal seizure, which we're going to talk about next. And sometimes it just dissipates and just doesn't come back at all once they get into their teen years. The grand mal seizure is the tonic-clonic seizure. This is a seizure that you're used to seeing like in movies, you know, when someone's on the floor shaking and things like that. This is your full-blown seizure. Some things that you need to know to help these people out if you ever see someone in that situation. People that have seizures, not all of them, but some of them get something called an aura, where they're able to kind of know when their seizure is about to happen. They get that aura, and in like 50 seconds to a minute, they'll have the seizure, right? So they'll give themselves some time to sit down, pull over if they're driving, which you're not supposed to be, but they'll sit down, they may lay on a couch or something like that until the seizure happens. That way they're protected. But if someone has a seizure right in front of you, first thing you want to do is try to catch them before they hit the floor. Because the last thing we want is their head banging against the floor, and that's just going to cause further injuries, all right? Next thing you want to do, clear the space around them, all right? If there's tables, chairs, anything that can harm them, push it away, because they're going to be flailing their arms. There's different ways the seizure can manifest itself. But they may be flailing their arms, so you want to push everything out the way. Tables, chairs, clear a nice space for them so that they have protection, all right? Put them on the side position, all right? Put them on the side position. That way it reduces the chances of the tongue rolling back into their mouth, okay? Now, when you're having a seizure, you're not breathing at all, but you want to try to keep that airway patent and open, okay? So, hand on the head, okay? If some people put pillows, there's a belief that you shouldn't put any pillows or blankets or anything like that over or under the head because they can suffocate themselves if they roll onto it. But, you know, you want to put a hand to protect the head from banging up against the floor or anything like that. That's good, all right? Keep them in that sideline position even after the seizure stops. And if you haven't already, call 911 and get the professionals there, okay? So keep them in that side position. Let their head be in a neutral position, all right? So if their head is all dropped down like this, put their head up in a neutral position to keep that airway open. Maybe tilt their head down towards the ground so they can spit out whatever secretions they may have in their mouth, all right? And if they don't speak to you right away, it's because they're in a postictal state, all right? It's going to take a few minutes until they become fully alert and oriented. Stay with them even after you call 911 because there's a great chance they can go into status epilepticus and they can have another seizure immediately right after the first one. So stay with them. That way, if it happens, you can still continue to protect them and keep them safe, all right? Don't put anything in their mouth. No fingers. They'll bite the finger right off. No tongue blades, no spoons or anything like that. Nothing goes in their mouth because their jaw's going to lock up and you don't want to break their teeth. All right, guys? God bless you. Take care of yourselves.